Good evening, everyone. Today, I am Dr. Harish Pathak, and you are watching the 389th non-stop edition of Dr. KK's MEDTalks. Our topic for discussion for today is lessons learned during the second wave. Let me introduce our panelists for today, who are Dr. Professor Rajiv Sood sir, who is founder and dean of RML Delhi, Dr. Sarman Singh sir, the director of AIMS Bhopal, Dr. B.L. Sherwal sir, Director of Rajiv Gandhi Super Specialty Hospital, Delhi, Dr. Sunita Chaudhary ma'am, Medical Superintendent of ESIC, Okhla. Before starting our today's discussion, let me give a small input over all the points that we're going to discuss today. So, so before I start the discussion, open the discussion for our panelists. All over the world, the COVID has been creating a havoc since 2019, which started in India since February 2020. Be the first lockdown of March 2020 or the second since April 2021, the complete experience had been really a tough one for everyone. Especially the second wave was a nightmare for all, and nobody would like to face anything so close to it even ever again. We learned a lot many things from the second wave. So today we have a panel of eminent doctors who will share their experiences about it. So before I begin it, I would like to start the questioning from Dr. Sarman sir that what has been the biggest cause of this havoc in the second wave in terms of mortality, morbidity, or any other thing that you think, sir? What has been the biggest thing that have created this havoc, sir? Sir, your mic is muted. Kindly unmute your mic, sir.
Thank you, Dr. Harish. Thank you very much. I would, before I start my little, points, I would request that through you, that if you can request that all other people they can, mute themselves, then it will be much better to, hear a clear voice. So, regarding your question, I would like to answer in nutshell, in 5 points. I think the first most important point was that the infrastructure. We all know that uh, though it was globally a major problem, and most of the countries they face this kind of challenges, but definitely in India we had a major problem with the our infrastructure, and we were not prepared, and the COVID epidemic, particularly the second wave, it exposed our systems, and it taught us that how we are in our infrastructure. So that was, I think, most important point, whether it is the hospital beds or oxygen or cylinders or supply chain. That is also very important, that even though we were knowing that we have the oxygen generated, but supply was not proper, supply tanks were not available. So that was, I think, the infrastructure was very important, very crucial. We also learned from this wave that only government setup, even though many a times we say that the private setup, they are more well managed, well, the coordinated, and they have better infrastructure. But this wave also taught us that uh, be it any kind of this kind of calamities or any epidemic type of thing, the only government setup is on the forefront, including the hospitals, the healthcare workers, including the administrator to bottom line up to class 4 employees or whatsoever we know. We also learned from this wave, and that the public behavior. And let me tell you why I'm emphasizing on the public behavior, because we did not learn from the first wave. And despite the fact that in Europe, whole of the Europe, we were knowing that second wave is bound to come, but in January and February, the kind of madras we saw in the festivities and all kind of things. I'm not naming, but the whether it is a political or religious or what, all kind of things. So people, they came out and they just forgot that we had a first wave, or any disease like that, and that led to this kind of serious complications. So that was, I think, a fourth point. The another point which I would like to emphasize, that we also had very unfortunately infodemics. And when I say infodemics, that was also very crucial, because we had lot of misinformation, less of correct information, and the majority of the information was a wrong information. Whether it is a remdesivir, people, they were killing or dying, and they are fighting for the remdesivir. And even though it was clinically questionable drug, but people thought that remdesivir is a ramban, and it will, so they were after doctors, they were after governments, they were after the pharmaceutical companies. We also know that because of infodemics, then some of the doctors and WhatsApp universities and all these things, the steroid overuse, misuse, and indiscriminate use of the steroid, that also led to the various complications, whether it is a more mortality, or it is a the fungal infections that was there. The infodemics also led to the kind of the hesitancy to vaccines, even though we had a vaccine from 16 January, but 2 3 months there was a lot of wrong information. You will get sterile, or you will not produce the babies, you will have this, you will have that, all kind of so all these kind of things, then they led to this kind of a very serious and severe second wave. And I hope that I still doubt that our people, our public has still learned these lessons even from the second wave. And for therefore I always say that people need to know, they need to be taught. They are learning, but I think they need to learn more and more. Thank you very much.
Sir, I really think you have raised a very good point in a very small, in a subtle way, and raised a lot many things that we all should have known. The next question, ma'am, Dr. Sunita, ma'am, I would raise the similar question with you, and highlighting the points which were essential in Delhi and everywhere. That what has been the biggest reason for havoc in different states, and from your perspective, what was the real problem that was the thing to disturb everyone?
Uh, Thank you, doctor. What I will like to conformity with the earlier speaker, that our response to the COVID second wave was a bit jerky. How it was? Reason being, first is this, that the trajectory which came to us as a patient was too steep. Delhi was not prepared. Delhi, I would say whole of the India, but particularly Delhi, it was not prepared to handle so many of the cases who came in the third week of the April at such a higher rate. We had around 2,000 ICU bed, but I remember on the night of 22nd April and 23rd April, I was in my hospital throughout the night, and there were the 60 ambulances parked outside my hospitals. And those 60 ambulances were with the patients, but I was not able to accommodate beyond a certain limit. So the trajectory which came to us, it was a very difficult for us to handle that amount of the patient which had suddenly come into the hospitals, and our healthcare structure totally collapsed. Why this collapsed? There were so many reasons which we have already spoken about it. The main reason was our inappropriate COVID behavior, which everyone was involved, whether it was a political, whether it was a social, or whether it was a national issue, where we could avoid, we knew it, the whole world knew it, that the second wave is coming. The second wave had already started in February in China, in Wuhan, but still our all political congregation, our all social gathering were not stopped. And the reason, we could all, as a healthcare expert, we could see Third possibility was that the disruption is supply chain management. Definitely, it has very well been explained. The oxygen supply, which needed to be given to the oxygen to the hospital, was nowhere available, and that had led to the chaos, whether it was a private sector, whether it was a public sector, or whatever it was. We could manage the things, we could handle the things, but definitely under a lot of pressure and a lot of intense pressure among us, the healthcare institutions and healthcare providers. Here I will disagree that the private bodies were doing much better than government bodies. Of course not. Government bodies were equally doing very good work. Under the resources crunch, we had lot of problems, but we were able to handle as much we could handle. But definitely, the second wave has given us lesson that for avoiding or for minimizing or for mitigating the third wave, we have to learn a lot. And these lessons which we have learned, we can discuss it in the future.
Thank you,
Thank
ma'am.
you,
You have
Doctor.
raised a very good point about, yes, ma'am. Thank you. And you have raised a very good point about the private and the government setups. I think that the government hospitals really have worked really hard in the crunch of the facilities and amenities that were available to them. And every institute, irrespective of the private, government, or the small or big, they worked for the betterment of the patients and nothing else. Sir, similarly, Dr. Shedwal, sir, I would like to know about your experiences so that you can enlighten our audience. What was your experience in the second wave?
I'm sorry I could not greet you because of my some connection was an issue. So namaskar, sir, and all the other speakers who has spoken before me. I'm in the same line actually. Although there are different of experiences which we have Dr. Saman and Dr. Chaudhary has shared. I will say that because I am also stationed in Delhi and I have very closely seen. I'll just say that second wave, I will say we each and every one, I'll not say responsible, we have witnessed it. And including the doctors, including the bureaucrats and the politicians, and of course, general public. Actually, we were, caught unaware, and we were not basically aware. We can always say that it is due to the lack of the COVID appropriate behavior, and because of the market or other assembling of the people in in functions or in any other festivals and so on. But at the same time, when we see that, as Dr. Sharman has very rightly pointed out, that we have never tested our infrastructure, and our infrastructure was stretched beyond limit. We were not aware. We have never heard, that require the number of beds. We can always see that if the pandemic will grow and more patients will be coming to the hospital, number of beds will be required. Number of beds to some extent can be increased. Number of ICU beds will be required, but number of ICU beds cannot be increased overnight. It needs time and HR. So that is not so easy. So everywhere we have seen that the infrastructure was an issue, HR was an issue, and every hospital was overcrowded, and there was no availability of the beds. And overall, I'll say that there were something wrong about the streamlining of the system. There was no way that the patients can be can know that there is a bed here, there is a ICU bed there are facility there. So they were just roaming about on the roads on their own, arranging the oxygen cylinder, arranging the oxygen concentrator, and whether they require or not. Unnecessarily, they were a hue and cry. Everybody just getting uh, pile up the oxygen concentrator, and the people was uh, unnecessarily going from one place to another, whether they need the admission in the hospital or not. Now I'll say that the disease in the second wave was definitely very severe, and the prognosis and the progress of the disease was very fast. And we have seen the people who are looking that they are going to be all right within a day or so, unfortunately we have lost them. So that was a different lesson in the second wave, that in spite of the best effort available, whatever the medicine, whatever the intervention which doctor can do, still lot many patients have died, and mortality was very high, not only in private but in government, but also in the private. So in spite of doing all efforts, the healthcare workers were really depressed to see that condition, particularly in the third week of April, and I'll say that 2 week of first and second week of May. Every healthcare worker will like to forget those days, and I will agree with Dr. Chaudhary that the oxygen shortage. Actually, as a doctor, I don't know. I have never had experience that we will be having 1 day shortage of the oxygen in the hospital. We never thought, and it will be such an important commodity that we will be struggling to get the oxygen for the patients. So that was a lesson, and definitely now every hospital is now trying to get oxygen streamline, whether it is aluminum capacity increase or procuring the other equipment like PSA, or streamlining the supply of the oxygen. I think that in future, let us hope that these things should not happen. Although challenges in Indian setting, I think still there, but I think it should be dealt in a better way. Thank you.
Sir, you are mute.
Dr. Harish, no voice.
Sir, I would like to say the next question is directed towards you. The question is, did the vaccination had its effect in the second wave, and what are going to be its if the consequences or the benefits in for the third wave that's going to come or about the corner?
Yeah, uh, important question these days. I think everybody is keen to know that what is the correct answer, but truly speaking, we know, again, as I said, that we knew little about the COVID. Similarly, we are learning, the data is coming, and therefore, so far, the data is available and the mutations are happening in the virus. It is, we can say that yes, it is effective to some extent, and this extent is that the vaccination is protective against the severity of the disease, and probably also to prevent the deaths in most of the patients, but it is not preventing the infection per se. And it is also recent studies from CDC and very reputed journals they have published that the transmission in vaccinated patient is almost similar to those who are not vaccinated. So means they are getting infected and they are also transmitting to others. And this is worrisome. The why it is worrisome that not only the unvaccinated and those who are vulnerable they might get infected, but most important, rather more important than that, is that the more the virus is replicating in your body, more chances of mutations are. It is a general phenomena for any microbe. If the more population of the organism, more chances of mutations. So more the population, it will in fact more chances of mutations will occur. And therefore we know that the India, because the population was so huge, and that's the region that we had a unique and very highly infectious and highly pathogenic virus mutated. And the variant, what we know that these days, uh, Delta variant. So that is very, very crucial, and we are really worried. All of us are worried that probably if the huge number what we have, we might have another wave, which is probably initiated or ignited by the new mutant. Even though so far, even the Delta variant, the wave caused by Delta variant has not yet finished. We know that in southern part of India, particularly the Kerala and up to Telangana and the other parts, Karnataka and the northeast, we know that this delta is still creating havoc, and this is not getting yet diminishing its pathogenicity or infectiousness. So therefore, even if no mutation or no new variant comes, delta itself is competent enough to bring another wave. So this is really, really something very worrisome, and therefore I always say that we need to adopt and we need to practice appropriate behavior. So beside vaccination, we have to have multi-pronged approach. One is, of course, vaccination. As I say, this will at least mitigate the deaths, oxygen requirement, ICU bed requirement, and our infrastructure will not collapse like what we had in April, May. But in addition to the vaccination, we also need to practice and adopt the universal precautions, or what we call these days appropriate behavior, COVID appropriate behavior, to be very precise. So, and out of, even though there are 15 parameter, 15 points in appropriate behavior, but at least three most important. And I am really concerned that the rallies and all these things were after November or December, because Uttar Pradesh and some other states, Punjab, they are still I think 6 months are there, and they might have another bout if the rallies like what we saw in West Bengal and other panchayat elections in UP. So if that happens again, I am really afraid that we might face another third wave. But if we continue to have vaccination, and vaccination means good number of vaccinees, because the vaccine supply, we are having a problem, and the government is trying its best. And today itself, only good news came that Johnson has also been approved for the emergency use. So now we have at least 4 vaccines, one indigenous and 3 they are from outside. So if we have the 4 vaccines, I hope that the supply will be maintained, and many more people, they will be vaccinated. So beside vaccination, we also continue the public. We cannot lower our guards. That is very, very crucial as far as the appropriate behaviors are concerned. Thank you.
Thank you, sir, for enlightening us. Moving on to the next question, Dr. Sunita ma'am, I'd like to ask your experiences about in the second wave, what happened was as the wave started coming up, the second wave started surging up, the number of cases started rising. With every passing hour, with every passing minute, the cases started rising. That would have happened in Delhi also. The thing was, but we as a doctor never had a common treatment protocol. Always the treatment protocols changed. There was a different thing coming up, sometimes a new antibiotic, or sometimes a new immunosuppressant, or maybe just a simple steroid. Every time the treatment protocol changed, and that always created a panic among the people, the general people, and the doctors too, because they were in the local hospitals or the local areas. The doctors were worried that what should be the treating choice because they were having a surge of people coming up. So, ma'am, what was your experience about this treatment protocol, and what have we all learned in this?
Yeah, Harish, very important question asked is that the every day the protocols were changing, and that was the real problem for us in the month of April. Like at the end of the in the month of end of March only, we could see that the cases are rising as the hospitals were doing rapid antigen as well as RT-PCR tests. We were every day seeing that the volume of the positive patients are increasing. We could foresee that yes, the cases are increasing and we are going to face the difficulty. At that time only, we our team of the doctor started looking for the literature, started looking for the newer methodology, started looking for the ICMR research papers, because the patients in the Delhi, they were also not that unaware. They used to come when the in the month of April, when there was a second wave was in the peak. Patient used to come with themselves with tocilizumab, with remdesivir, with injectables, and they used to insist upon, doctor, why don't you give this injection to my patient? Why you cannot save my patient by giving this injection? So one thing is the doctors were also in the conflict. At what day we have to start remdesivir? At what day we have start to tocilizumab? Where is the patient proning position? Like we were involved in the management itself, and we were at a crossroad with the patient's query too, because the patients were so much, as Dr. Singh has told about the WhatsApp University and all these university, the patients were being misguided by the various information agencies, what is good and what is not good. So the doctors had a double or triple conflicting role, how to take care of the patient, how to convince the patient's attendant, and how to give the right information for the particular treatment of a particular patient. That led to a discovery that definitely every extreme situation gives some innovations too. So in my hospital, every day we were doing some medical education program on Google Meet and discussing everything in a newer aspect. My medical specialist, my anesthesiologist, we were discussing each and every patient who were in the ICU care or who were in the high dependency units, how to go ahead with it. But definitely the research methodology of ICMR or WHO, they really helped us. We wanted to be doubly sure what treatment we have to adopt, and suddenly in the private sector, that cocktail treatment came into the picture, and the government health structure was pressurized so much to adapt that cocktail treatment, that we had to ultimately tell them that we are here to save the patient in the reasonable resources. We cannot go beyond a particular resources to take care of our patients, and these triple cocktail treatment or tocilizumab treatment can wait. First and foremost, we have to give the reasonable care and try to save our patient as much as we could do. And we had been very successful also. In my hospital, if I see my data, the mortality, I have a 200 bedded ICU at that time, which I had made it. And I could see the mortality was around 25 to 28% during that, from April 20th till April 30th. So the various mechanism which I had adopted during that time had really helped us to go into the solution of that COVID pandemic cases. That's all from my side. Thank you.
Sherwal sir, moving the same question a little forward, sir, just as I mentioned about the general protocol for treatment for every patient that came out from the government side, from different institutes, at time to time and changed from time to time, and the treatment that were given were blamed for different of its side effects. Sometimes they were included, sometimes they were excluded. So what are your experiences? Whether a simple protocol that has to be used for every patient or an individualized treatment has to be given to every patient so that we can use that for the third wave. What is the final verdict about it? Because even the third wave, if the same thing is followed, we are yet going to face another havoc, another misguided approach towards the patient. and for their betterment.
No, see, as far as treatment is concerned, we agree that there was no uniform protocol, and it keep on changing from time to time. Right from WHO to ICMR, Government of India, and state level, or ultimately at the hospital level. But I'll say that what matter is clinicians who are there at the situation. One, number two, there are pressure also from the patient and attendant, as Dr. Chaudhary has also said and Dr. Sharman has also said. They come prepared and they say that particularly people have been transferred from private to government hospital to get medicine, particular medicine that is not available there. And we have come to know that so and so hospital have remdesivir and you have the plasma. So give plasma to my patient, give tocilizumab to my patient. So that happened. But as Dr. Chaudhary has just said, we have also, luckily our hospital have senior pulmonologist, Dr. Dogra is there, and who is also advising the Delhi government also for the treatment. And our hospital was the one in the second wave. We have hardly given remdesivir to one or two patients, that too only on the request. Otherwise, we have not at all asked remdesivir to our patients. And we also have the similar kind of mortality which Dr. Chaudhary has just said. And but at the same time, we will say that they were pressure and they were need, and doctor were forced to write the antibiotics, and the steroid was another issue. They were being patients were put on the steroid. Now it was later on we have seen that how overuse or misuse had proved. I'll say that दूर से निकले और जार में गिरने वाला जो है, because mucormycosis, we have seen how deadly disease the people have suffered. Many patients have lost their life. They got all right from the COVID, but they died because of the mucormycosis. That is another unfortunate thing. But I'll say that we are learning, and because this disease is new disease, and treatment will keep on suffering, keep on changing till the time we found medicine which is specifically for COVID, which nowadays basically till now we have what we have done is we have repurposed the medicine actually, which are meant for other disease earlier, tried for other disease, other virus or other even parasitic or bacterial disease. So those has been tried. So these are all repurposed. Some if the patients have shown some effect, so now the word of mouth people will say that I have treated so many patients with this drug or that drug, and
Dr. Haris, I would like to add on something, on this topic before you
Yes,
ask
sir.
another question. I think, as Dr. Chaudhary, Dr. Serwal very rightly said that, there was a lot of pressure from the public and Google and WhatsApp. Sometimes the patient, they came and, everywhere it was, I need, I have seen prescription having 22 medicines, all the, antibiotics and all, steroids, ivermectin, and, you name SCQ, everything up to 22, from my own eyes. But let me tell you good news that the probably government realized all the protocols. Even though I am from AIMS, but it is a fact that AIMS was the only institution which was having the protocols which were modified time to time, and these were the experiences from the AIMS faculty only, AIMS Delhi faculty, and in collaboration with the ICMR and the Ministry of Health. But lately, though, the DGHS came into picture, and he has done, the Directorate of Health Services had done very excellent work. Now what they have done, that they have made the task forces and the groups for all the protocols. So as of today, the for adults, for mucormycosis, for pediatric, and all the protocols are ready, and they are, if you anybody, I would like to through this webinar, I would like to convey to all the listeners that they can go to DGHS website. All protocols are now in place for the third wave. Thank you. You are mute.
Sir, I would like to add in the same continuation from you, Dr. Soman sir, that the second wave, the first wave had different predilection of the infection about in the terms of age, sex, or people coming from different places. Similarly, the second wave have different predilection. Then it's now being predicted that the third wave will be having something else. Sir, would you like to enlighten all of us that what's the basic reason about it and what will be the future predilection for the same, sir, in the terms of
Dr.
age,
Aris,
sex, and the people ethnicity? Yes, sir.
Dr. Haris, let me tell you, because I think through this webinar, we should not, give incorrect information which is not yet validated. I don't think that virus has any predilection to any age group, or any age or gender is immune to. So that is the bottom line. Now the question is that why the one can ask that why the second wave we had more adults, or the reproductive age group. So the reason was not because of the virus. This we need to understand. It was not because of the virus. Virus was having any predilection. No, it is not. The reason was that for the first wave, the virus was less pathogenic. The infectiousness was less, and therefore the dose of the virus was about 2000 virions. So obviously the old age people, those who are having lesser immunity because they got infected, and the young adults, they were able to mount the immunity sufficient enough to cope with the 2000 virions. You will be surprised that in this the mutated virus, which the second wave was driven by mainly by delta virus. Delta virus has the very minimal dose. It infects very fast, because it can, even the 200 to 300 virions can have the disease. They can manifest the viral load, because it multiplies very fast. So viral load is also very high. So viral load is high means then even the doctors, they are at higher risk. So because you are your through your breath you are excreting more and more virus load. So that was the reason that doctors, the paramedics, which for the first time we had huge number we required to get infected, about 2000 and more than that. This time we had 200 to 300 virions, and which was good enough even if you are having N95 or other equipments. This the virion number of viruses required to infect you, they were less. Now again, the similar, the dictum people say that the third wave, the pediatric age group, this is also wrong. And I think in Hindi में बताना better, some बताऊंगा मैं कि बच्चे भी और बच्चे ही. I always say whenever I talk on TV. So there is a difference. बच्चे भी and बच्चे ही. There is a lot of difference. बच्चे भी होंगे, yes, but बच्चे ही होंगे, no. So ऐसा नहीं है, because the only children will get infected, but the children will get infected mainly because they are not vaccinated. Most of the people, adults and old age people, we are vaccinating them. So that may be the reason that child will get infected, for the reason because they are not vaccinated, not because the virus is having any predilection to any age group. Even though one mutant in USA was mutant 240 variant, name was not given, but one mutant was given the name 240. So that was known that in female, American female, that was having little more significant number of women infected, but that was ultimately that was not found to be reproducible data in other countries, because that was sometimes the data we collect and we analyze, and these are incidental findings. So, but after that, no variant has been found to have more infectivity to particular age. The viruses are equally infectious to all age group, but depends on your immunity, if you are vaccinated or not, and how much dose you have taken. So dose is very important. If you are close vicinity, your air dynamics of the, if you are, even if in the rally, sometimes many people they say that many people they were having the political rallies, but they didn't get. The reason is the dynamics, air dynamics, and virus dilution. All these things, critical things, we need to understand. So I think the third wave might infect all those who are not vaccinated, including the children. So I would like to say like that. Thank you.
Yes, sir. Thank you, sir, for just removing all the false facts that were roaming around, because that will be very helpful to everyone. Moving on to Dr. Sunita, ma'am. Ma'am, in terms of Delhi, this question will be that in the second wave, for the first wave, first let me know about the first wave. What happened that it was just a sudden exposure to all of us. It was a new thing, a new phenomena, and people were not ready. The government was not ready. So imposing a lockdown was not a necessity, not an option. It became a necessity, and but we learned something or the other from the first wave. Then moving on to the second wave, we knew that it has to be done to curb down the infection rate and to curb down the number of people that are coming positive. What have we finally learned from the first or the second wave, moving towards that we are already moving towards the third wave? So ma'am, what will be your experience about the second wave, and that what we have finally learned from it, and in the future for the third wave, what can be done about it, ma'am?
Yeah, Harish, I will comment upon it that third wave is going to come. Whatever we say already, the Europe and US have started experiencing it in spite of their population near to the complete vaccination. So it happens in all the pandemic. My colleagues will agree to it that in all the pandemics, these waves and the clusters keep on coming and going as a part of the
Dr. Harish,
normal
सुन
viral
नहीं रहा.
cycle. Hello, hello.
Sir,
Am I audible?
ma'am, yes, ma'am, you're audible, ma'am.
Yeah. So that means this will be all these surges will be coming and going, and as Sir has said, Dr. Suman said that we should not give the misinformation about it that the only the pediatric population is going to be affected. No, any population can be affected by the third wave. The population which will more vulnerable will be the one who have been left without vaccination. Definitely that is going to create an impact on the society. And what as a healthcare expert or healthcare administrator we have learned from our two previous experiences are, first is third wave is going to come. We have to get our preparation going irrespective of the number of the cases coming to us. So we cannot sit in a relaxed position that no, we are not going to have that much load which we had in the second wave. Definitely, we have to be prepared for the worst, and we are preparing ourselves. One thing is which government can do and government is doing is the vaccination. Vaccination should be on the full swing, and we should make it sure that our country, as early as it gets vaccinated, the mitigation of impact is going to be taken care of. Second impact which comes, that is has to be taken care of, is the COVID appropriate behavior which we are talking again and again and again and again. In spite of being our vaccinated, in spite of being our waving off of the second wave, in spite of this that the third wave is too far off, we cannot forego our guards down. We cannot let ourselves at a very safe place that nothing can happen to us. The public has to be sensitized that yes, you cannot go like this without mask, without social distancing, and any COVID appropriate behavior that has to be followed at all the cost. Third thing which comes to our mind is which we have seen from the second wave, that our supply chain management should be totally intact. It should not be broken at any point of the time, at any place, pan India. I'm not talking about Delhi. I'm talking about other cities, that is tier 2 city, tier 3 cities. Delhi has been taken care of by the government post second wave. Now I think all the hospitals, especially I will talk because I'm a government doctor, all government hospitals have been taken care of by giving the oxygen generation plant, by giving LMOs, by enough amount of oxygen cylinder. But that thing should carry on with all tier 2 and tier 3 cities, because the, the, the cases which be coming from the third wave will be scattered in the tier 2 tier 3 city because of the non vaccination status of those cities. So now as healthcare expert we have to concentrate more on those parts of our country. Fourth point which I have observed and I find that is important to share is automation of the health services. Telemedicine. Telemedicine becomes a very important and a crucial factor in taking care of the pandemics. We have very good health expert. We have got very good healthcare services in the metro cities. But what to talk about the remote places? What to talk about the people who are staying at home, who are sitting at home, who are in isolation, who are in quarantine centers? They have to be taken care of by the expert people. They should not be taken care by the quackeries. They should not be taken care by the quack, which have loaded them with lot of the steroids, lot of medrols at the very inappropriate time of the treatment, and which has resulted into that vast epidemic of mucormycosis. So these are the things which we have to, as a government, as a healthcare administrator, we have to go into a telemedicine system. Fourth and final thing which I want is the updation of everything on a automated system, where the oxygen is, where the beds are, where the ICU facilities are available. They should be available in an automated way in a particular system on a one health portal, so that the people can find out from their home that which hospital they have to approach, and they should also be associated with the GPRS coordinates also, so that the people don't have to run 40 kilometer, 50 kilometer, 60 kilometer. They can see from their place, yes, if my facility is available at 3 kilometers from my home, I should first go to that facility. Rest of the thing which government can do, I think we can very well acknowledge and appreciate it, that we can make the hospital in makeshift manner whenever it is required to, whenever we get the load of the patient, whenever there is a bigger trajectory. Even in the past also, historically also, government has proved that they can do it. They do it also, and that we really appreciate it. So the various features we have learned from the first and second wave experience, I think they should help us to take care of the third wave in a very positive and in a very appropriate manner. Thank you.
Yes, ma'am. Thank you very much. I think that we all agree, will all agree with a point that during the second wave, there was a crunch of amenities and facilities in terms of whether it be the oxygen, the beds availability, or it could be the medication, or it could be the lack of healthcare workers, the frontline warriors that were present there. It really showed the lack of infrastructure for the healthcare for people in India. I think I won't take a comment upon this topic from anyone, because that is a thing that every healthcare worker who has really worked in the second epidemic or pandemic will agree. I would, but finally, I would like to just take one final verdict from all of our panelists tonight. For tonight, this is the last question, and I would like a single line answer from everyone. Uh, I think Shrival sir is having some technical glitch. So moving on to Sarman sir. Sir, one final line. What have we learned from second wave, and how could we use that for our third waves?
Yeah, Harish, as we have been talking, and other my two colleagues, we have been discussing. definitely we have learned that where we stand. So we need to strengthen our infrastructure, and as Dr. Sunita very rightly said, that in the tier one cities we had comparatively better infrastructure, but in the rural areas they were really very bad shape. I can say with proud that in Madhya Pradesh we were the center of excellence, and we were coordinating the entire state. So we could, and advisory board of the honorable chief minister. So we could, the what Dr. Sunita Chaudhary was saying, that we could have the digital portal, so that the people were knowing that oxygen where it is available and where it is not. So there, that was there, that was in place, and I think that need to be done to in the all states across the country. So that is very very important, and I think we are much prepared. The protocols are in place. Oxygen plants, sufficient oxygen plants are available. The beds are also available. So I think we are now, uh, we are, as of now, our understanding is that we are well prepared to take care of the third wave, but we never know what kind of virus it comes and what manifestations it comes with. So we cannot be so sure, but definitely we are guardedly, I can say, we are prepared. Thank you.
We have our fourth panelist tonight here. Good evening, sir. Sir, Dr. Professor Dr. Rajiv Sood sir has joined us. He is founder and dean at RML Delhi. Sir, we are with our panelists about what lessons we have learned during the second wave. Sir, kindly you enlighten us. What are the important things that we have really learned from the second wave of pandemic that we are facing of COVID? So, what are your opinions? Dr. Rajiv, sir, can you hear us?
Dr. Harish,
Yes, sir.
can I add with Dr. Chaudhary? You have asked the question that the
Sure, sir, sure.
lockdown, regarding
Kind,
the lockdown.
yes, sir. Kindly add on, sir.
Yeah, we all know that during the second wave, lockdown was really late, and it was in Delhi put on 20th of March, April. That time, the number of cases, on 20th, it was 28,395. Positivity was around 35-36%. So definitely it was late. But I feel, we need to inform that now Delhi government, I do not know other government has prepared or not, but Delhi government has prepared a plan which is known as graded response plan, or color coded plan for COVID, which is basically we have to watch if it is yellow, amber, orange, and red. So if the cases positivity rate 0.5% continuously consecutively for 2 days, so we have to basically follow that, and restriction have to put according to that protocol which we have fixed. Then accordingly, when there is 1% positivity rate continuously for 2 days, and the number of beds required is around 1500. So then the restrictions will be little higher up. And then when there is 2% positivity continuously for 2 days, more restriction will be there. And when the red means 5% positivity continuously for 2 days, complete curfew will be allowed there in Delhi. All the activity barring only essential services, everything will be cut down. The advantage of this plan will be that the government need not to go to cabinet or to honorable LG every time. It has been already the approval of the cabinet and the honorable LG, and we will be aware the public will be aware that if the positivity rate will be of this level, we should be ready to face the lockdown. So it will be basically enforce people to have application of proper COVID behavior, and it will definitely people will be more aware that if we do not take care of the appropriate COVID behavior, we don't apply, and it is going to number of cases will increase, and then ultimately the complete lockdown will be there. So that is one thing which government has done. Another thing is number of beds. Delhi government has really worked very hard, and during the second wave, we know that number of beds required estimated was around 45,000, but we were not having around 20,000 beds were there. So this time already 37,000 beds has been arranged by the government, and I'm hopeful that another 3-4,000 beds are on the way. So we will be able to match that requirement which we could not match during the second wave. So that is another thing. And HR is another thing. So basically, there is a shortage of the healthcare worker, whether it is doctor, whether it is nurse, whether it is technician. So for that also, in addition to hiring, and in addition to various method to hire, one is to increase the salary on contract basis. People have been allowed on per day basis, and very high salary like 15,000 per day. It's been allowed if the consultant is available with 5 years of experience. And also now there is a way that there are lot many medical officers, there are lot many nurses, lot many technicians who are not into medical area, not into ICU area. Those has been trained. They have been virtually trained. They have given the hands-on training. Also, 6-day intensive training has been arranged in our hospital, that is Rajiv Gandhi. Already, we have the data of each and every trained person. Uh, I feel they will be of use, and at the time of need, this workforce definitely will be put on COVID duty, and in the hospital wherever there is shortage. Plus, we have also requested the government to pool the resources, because we have seen in some of the hospital there are medicine people, there are anesthesia people, there are government medicine people, but at some hospital they are managing large number of COVID patients, but they don't have specialists. So that is also important. And this time I'm quite hopeful that government will be doing the pooling and distributing the qualified healthcare worker to distance hospital, which will be life saving for the people who will be admitted in the hospital like Gorari Hospital or Ambedkar Nagar Hospital, which are far distance. And also, like we have recommended to the government, and we have changed in Rajiv Gandhi. Actually, instead of the holding area, we have changed our emergency into the rapid response team, and we have made in such a way that we need not to refuse to any patient. If they comes, we will be taking those patients, and we have created a 30-bedded full-fledged ICU in the basically on the doorstep of the hospital, and with all facility. And we have kept the cycle of 6 hours, that after 6 hours that bed will be vacated and patient will be shifted into inside the hospital or any other hospital if we do not have a bed inside the hospital. So we will be trying that patient need not to refuse. We give them the first aid. Maybe sometime the patients are coming with the oxygen saturation 60, even 70, or some patients have come even less than 50 percent of oxygen saturation. So at that time, actually nothing is needed, only oxygen is needed. If we can provide them oxygen right at the doorstep of the hospital, and what we have done is that ambulance can walk in into the almost ICU. There we can take
Sir,
immediately the patient inside.
sir, we are
So
having
that
a little
we
crunch
will
of
try
time,
that
sir.
Delhi
I would
government
like to
hospital can
interrupt
have
you.
that kind of structure. Thank you.
So, thank you, sir. In the crunch of time, sir, sorry, we are having a limitation to it, but Dr. Professor Rajiv Sood, sir, has joined us a little late. So, sir, we would like to hear your final verdict about your experience about the second wave that we all have faced and what we have really learned from it and what that it could be beneficial to us for the third wave that are about the corner, sir.
Uh, Thank you for inviting me in this important discussion. Dr. Sherwal was explaining his experience, and we have our experience of Atal Bihari Vajpayee Institute of Medical Sciences, RML Hospital. I'll like to stress on again the four components which were just discussed in various forums. They are the beds, the availability of beds, and also how you assign the beds. Actually, initially in the first wave, we have already all ever present ward for infectious diseases, keeping for dengue, keeping for H1N1 and all, and we thought we are fully equipped, and then we realized very soon that we need more space, more beds, and then absurdly the one floor is allotted, one building is allotted, and it was a lot of mixing, which was a wrong thing, which was realized. And in the second wave, we were caught unaware that so many beds are going to be needed. Now the thing is that other patients also suffered, like our cancer patients suffered, our heart patients suffered. There was a crunch, and some patients in ICU. Even today, we are not able to admit unless we do the COVID test. Even if they are serious, we have to keep them in some places where they are not supposed to be. They are supposed to get ICU care immediately. So beds is was the problem. Beds were created, a lot of beds were created by government, but they were not the oxygen beds. So second comes the oxygen, the same amount of oxygen which was sufficient for 1 lakh daily patients in Bombay. The same oxygen was not sufficient in Delhi. So we needed four times of oxygen to meet that demand. Therefore, the distribution and management of oxygen, that becomes the second important lesson which we realized, and that the government is taking steps and trying to do that, so that the third wave we are not caught because of this decision. Then third is the supply. The supply of critical medicines, critical material, critical equipment. That is very important when sudden pandemic is there. Sudden, we were in a position, we had seen lot of trauma, lot of accidents, mass casualties in the traumatic disasters, and we were managing that. But we had not managed in the past such a grand scale pandemic of infectious disease, and that was another lesson, that we should be prepared with the supplies, so that there is no black marketing, there is no stress on the patients and the doctors. You see that in second wave, even doctors whole night they were not sleeping, and they were in the queues to get their oxygen. And the medicines remdesivir, people were not knowing whether it is life saving, not life saving, whether it should be given in the early stage, late stage. Once they hear from the doctor that get remdesivir, and even if the patient is in the late stage of the disease, they start searching, and they start spending lot of money. So we have to have proper understanding, and that we are not telling any person who is the middle economy group or a lower economy group, and you call them that you with the remdesivir, they think the patient will be saved, but it was too late. So we should know that how to communicate, and also the medical staff, which Dr. Sherwal was just discussing, The medical staff is very important. Paramedical staff is very important, and training of them. That sudden demand training. There should be a provision in built provision that how you are going to train them at short notice, and that was lacking, which has been started. Online training and all other measures we are taking up. Even nurses have made their groups of medical education and training on online training and all, but that is one thing. And I'll tell you that we are saying that we will recruit people, we will pay them extra, but if it is IS, it is civil services, other services, many services, there are inbuilt reserves for the thing. I'll tell you, there are probation reserve, there is some deputation reserve, there is a leave reserve, all kind of reserves are there. Whatever is your cadre strength, 1.5 time of that is in the reserve. And we know that as per population also we are in shortage. We have lot of deficiencies in the population. This doctor and nurses and other paramedical staff requirement. I know about my hospital that when we were facing the first wave itself, 1,000 vacancies of class 3 and 4 staff were abolished because they were lying vacant for last 4 5 years. Now what will happen? You need more people and you are abolishing the vacancies, you are not filling. And many places I've seen in various programs that ventilators are there, but how to operate those ventilators people were not knowing. So infrastructure is the most important. Next is the your the equipment and also the manpower placement and training. We were lacking, definitely we were lacking, and we were trying to overstretch the existing manpower, existing doctors for prolonged duties. And when this pandemic has extended to 1.5 years already, and same doctors are continuing and getting stretched, and mental exhaustion is there. Now the mental health very important. We have made the telecounseling group also and other things, but what we are doing, that is for patients, that is for the family members also we are trying to assess. But who is assessing? The doctors who are already overstretched, their mental health is not taken care of. They are getting exhausted, they are getting frustrated, and they are now at at the point of breaking, total mental breaking. And you have seen the suicides also in this period by the medical staff. And also this mental health addressing was not is not there. Now I know that I'm very open to discuss, because I'm known to that I open the things very openly. When first wave was over and second wave was looming in other countries, we thought that we are totally protected now, and we try to decrease the expenditure at the end of the budget year. That was by 31st of March, around 100 crore my institution itself has returned to the ministry. So instead of spending and creating the more infrastructure, the instructions, bureaucratic instructions rather, were that decrease the expenditure, and that is wrong. And you should rather keep the excessive supply, excessive space, open spaces are to be kept. The high risk patients, non-COVID patients, should be shifted to the other hospitals, so that the COVID hospitals and non-COVID facilities, they should not be mixed. There was an order of the government that 20% beds are reserved. That means that you make them 20% and you expose all the beds to COVID. So this is also a great lesson. And second wave, after second wave, we have seen the public behavior, COVID appropriate behavior. Now also after second wave has gone, people have started thinking that whatever is the third wave is coming, and quickly we should finish all our things. Marriages, parties, everything is open now. and they are trying that quickly you do everything so that third wave आ जाएगी उससे पहले हम कर लें. But a third wave will come because of these activities only, because of the sacrificing the norms, the COVID appropriate behavior we are sacrificing, and therefore the third wave will come. And the curves which you have shown in your presentations, those curves will be the dangerous curves, and you know that in some places there are fourth wave already. The Tunisia was the country where third wave came. Now the third wave is in many places, and some places fourth wave is coming, and waves will keep on coming unless we vaccinate. We have already discussed. So vaccinate, vaccinate, and vaccinate. This is the mantra. Now, other than the COVID appropriate norms, vaccination and herd immunity, unless we reach that, because we are finding that whether it is Delta or Delta Plus or Kappa or Lambda, whatever variants are coming, the more variants will come unless we vaccinate fast. And therefore, if we vaccinate, we have heard about T cell immunity and other protective measures, and all vaccines are effective. And therefore, at the end, I like to stress that our 60% or 70% population is in the rural area, and in the rural area, the medical manpower, health manpower is not trained at all, and the provisions for training them is also not in place. The supplies are not there, and if you have chance to travel in the interior of some places, I have been to Himachal, I have been to hilly areas, I have been to Uttarakhand. You know, there no COVID was there in the first wave, and in the second wave, some of the places, every village was having COVID. So I have not traveled to Uttar Pradesh and all, but we have seen, but very good steps have been taken there. That if pediatric vaccines are not there, then they have Madhya Pradesh and Uttar Pradesh started vaccinating on priority the parents of such students or such children. And the best thing is going to be the nasal vaccines, because these vaccines are creating immunoglobulin G, and a nasal vaccine will create immunoglobulin A, and A will protect the entry itself of the virus. What we are doing after giving intramuscular injections, we are creating the immunity. First, the virus will enter, and then there will be protection. But at the entry point, also is itself, if protection is there, then nasal vaccines and they are getting developed, and India is also doing a lot in that. Government is doing wonderful work. So, combining all this, and you have also discussed about the booster dose. I think that if somebody has got already COVID, and then you are vaccinating, then it is all right. But those who are protected from COVID, at least in first go, the booster dose should be given to them. So that they get better antibodies if we start a booster dosing. If we are not starting, then it is a different matter. And those who have already got COVID, there are studies now that COVID, after COVID, the first dose, if you give, it is equal to 2 COVID doses. And therefore so many insights are coming, so many understanding, the whole scenario is coming. I'll again stress at the end that if you are not developing your infrastructure, if you are not developing properly your infrastructure, first the infrastructure should be there adequate. It should not be only be adequate, it should be with the bonus. Manpower should be with the reserves. It is the principle given by Department of Personnel and Training, that wherever you create a service, there should be around 25 to 35% reserves. I mean, the requirement is 1,000. There should be 200, 300 more staff to be recruited. But what is happening here? Out of 1,000, there are 300 vacancies, and you are trying to get the ad hoc people, and there was hesitancy in joining also by those people, that this is the COVID time and they are giving temporary jobs, ad hoc jobs. They are not going to make their career, and those who are the students studies, they are affected. So we should encourage, which is happening now, the telemedicine, distant learning programs, education and fast training modules, so that we can train the manpower in the new emergency times immediately as per requirement. And villages are also to be focused, unless there will be endemics and there will be pockets where corona will persist and it will come back. So therefore, I think I'll sum up this. I have tried to sum up in these words, addressing the main problems which we face in first and second wave. And there should be
Yes, sir.
proper planning, not only for corona but for the other disasters which are going to come in future.
Thank you, sir. Thank you a lot. Sir, I'm very sorry to all the eminent panelists that I'm taking a little more extra time from the designated time period. But at the last final question, sir has already mentioned this that there was some administrative mistakes or mismanagement in the period that happened. There was also that the doctors faced so much problem that we, with the whole discussion, we talked only about the general population, about the normal people, about the first, second wave, but we didn't ever mention about the doctors. They worked really hard. The COVID warriors faced the people front line, faced the problem head to head. So, so don't we all think that we really should have Indian medical services in action? And also for the protection of all the doctors, there should be some provision of Central Protection Act or something like that. I would like to take a few lines from everyone in the panel, starting with Sood sir. Sir, could you just
See,
give
the
your
Indian medical service, which
yes, sir?
was the demand. This was not actually the demand; it was the vision of the government that three after creating Indian administrative services and the Indian police service, three more services will be created, and one was Indian Forest Service, another was Indian Medical Service. A need was there, definitely, because health became the state subject, the consent of all the states were required. Then to shortcut that, under a provision 312 of the Indian Constitution, when Rajya Sabha can pass some resolution, and by that passing that resolution, Indian Forest Service and Indian Medical Service were created. Indian Medical Service was notified. Department of Personnel and Training has put up the rules also, and it was sent then it was pointed out that it is a state subject. Committee of secretaries meeting was called, and many when it was going to be created, there was emergency period. This is for your knowledge, who are the young persons. I was there at that time, and in 1975 to 1977, whatever decision government was taking, whether they were right or wrong, Morarji Desai government came, and that cabinet blocked all the, not Indian Medical Service, but all the services. It was passed in Rajya Sabha. It was President of India has signed that, and it was implemented also. And since then, now all the governments, they are only moving the papers and not getting done. Now it was taken up by I was made by Indian Medical Association, the convener for giving the document. It was put as the Indian Medical Service document, and it was passed. I was in Medical Council of India also, and there I raised it in the general body. I got it passed there. Dr. VP Mishra was the chairman of that committee. I presented all the papers, and we got from National Archives also paper, and ultimately it got passed in Indian Medical Association also. Now Parliamentary Committee has also passed. Now, but bureaucrats, I am very sorry to say, they don't want it, because they don't want the dilution of the power, because today there is no DG. Uh, You may say that there is a DG, but he is not the regular DG. Ad hoc is of, because he is not in the scale of DG. Special DGs, nobody is there. In 1996, there was a High Court warning and decision that within 1 year fill all the vacancies. Not done. All the higher administrative grade posts mostly remain vacant in last 20 years. And what is happening that everything is managed by the joint secretary level officer of Ministry of Health and Family Welfare. He dictates what the DGHS has to done. DGHS had 20 years back 129 units under him, and now there are only 2 units under him. So you can see that not only units have gone, but the staff in the units have also gone to the bureaucratic control. And nobody, the beneficiaries of the quality system, they don't want that system to be corrected. And if you want Indian medical service, then there has to be a proper thinking and action plan by the young doctors. Because when I was young, I started all this movement. I can tell you that the day I joined service, I created Joint Action Council of Service Doctors, and gradually I rose to the position of dean. But my thinking remained the same. And today also we have the IMA standing committee of service doctors and allied services, and this is our first demand. And I'm the chair. I have been appointed chairman by Indian Medical Association last month, and I am with you. But I'll tell you that I can only show you that what is to be done. I can introduce to you the history back, that what all has happened, what all can be done. But everything has to be done by young doctors, because after 2 3 years I'll also get superannuated, and that is more difficult is now the present. I'm not criticizing the government, but even the politics we cannot join, because you will not get the ticket if you are 65 years or 70 year plus. So all honors comes on the young doctors, and young doctors have to do everything in unison. And Indian medical service is already created. It is blocked. It was already notified. It has been withdrawn. And this is the right time when you all should raise it as the first demand of your. And once Indian medical services there, when what I was talking about reserves, na, that is automatically there, because Indian all India services are controlled by Department of Personnel, and your service is controlled by your ministry. So if any service is controlled by Department of Personal Training, uniform rules are applied, then you will have no shortage of vacancies, you will have no shortage of higher administrative positions, you will have no shortage of authority, and you will have ex officio positions of secretary, joint secretary, additional secretary. Today, your DG is in the secretary scale. He will get more pension than Secretary of Government of India, but he has no power. So we know that we have to have the protocol, we have to have respectability, and we should have the authority in the medical decisions, medical administrative decisions also, and that is possible by Indian medical service only.
Thank you for enlightening us about the past, the future, and the present about the Indian medical services and about the protection that all the doctors really need, and about the potential about the healthcare workers that they have really worked hard in the first or the second wave, and we really promise, the youngsters really promise to work similarly in the future also. So finally concluding it up, today I think we had some mind-opening discussion regarding experience of the second wave. We surfed through several talks like the treatment protocols, the vaccination, the lockdown and its effect, and many more. Finally, we have concluded that the third wave is still at the nook, and we have to be on our tips and for a healthy future, because anything can happen at any time. It's a new thing that we are facing. So we all have to be ready about it. Thank you all, our eminent panelists, for giving us your valuable time. Thank you.
Thank you so much.
Thank you all.
Thank you. Thank you.
Thank you.